All right, you guys, we are on part 2 of our full facial rejuvenation plan. Not only skin tightening, but also texture, color, and tone, and improvement in scars. We did deep microneedling radiofrequency equivalent to about 3 millimeters in depth, tightening of the skin with Fractora and improving scars. Now we're on the surface. To give you a perspective, this is about 200 to 300 microns, which is about 0.3 millimeters, so all the sun damage and all of the pores and discoloration, especially precancer cells, pigmentation, fine lines, and crepey skin will be improved with this. So now we're on the surface. The combination of both is going to give him more extreme rejuvenation. You're good. Actually, let me take this from you. Let me take that one. Turn your head to the left. Yeah, perfect. Then doing either one alone. And it's very important you get the proper information, because a lot of times people will tell you that any energy device will improve the texture or color of the skin, and that's not true. Like I told you with the Fractora, you're not improving the texture of the skin, or at least the superficial color. You're going to do some stimulation there, but it's not going to be as extensive. So now we're really now going to be more extensive on the surface. So we're moving all the way across. How does this feel so people understand? Because obviously it's
like
not...
they're shaving. Like
you're shaving with rough razor, right?
Yeah.
Yeah, I mean it's a little painful, especially more for men, because they have hair follicles, so the numbing cream doesn't work as well. I mean, we can give nerve blocks. We could do topical. I can do more topical, which we've done. Ours is pretty strong, and then also can give pills. But I don't know. Most people are usually totally fine. But how does it feel during the healing time? Because you've done this a bunch.
Well, I heal pretty quickly.
Yeah, you heal unbelievable. Your skin's like baby. It's got like amazing stem cells. It just heals itself. But does it hurt when it's healing?
No.
No. This is cool, even though it looks really red.
Yeah, it's just red.
Cool. Any questions from the gallery? No? Nothing?
Does this affect facial hair?
It does not affect facial hair, which is great. But the one thing I do want to point out is that this is my go-to maintenance treatment. Fraxel is the only non-ablative laser that's ever been FDA approved for a cancerous condition, pre-cancers and skin cancers. So for those with, like him, blonde hair, blue eyes that are very high risk for developing skin cancer over time and sun damage as they age, this is the treatment you should be doing every 3 or 4 months no matter what. That's number one. Number two is you should be doing something stronger at least every 2-3 months to get exfoliation and peeling in your skin. It's now peel season, October, November, December. And he's starting peel season with a laser peel, basically, which is great. And then we would tell him to maintain this in a few weeks to a month with the peel and kind of alternate those things so that we're really working at all levels on the skin. You're almost done on this side. So it starts to build up heat. You can see it hurts a little bit more as we build up the heat. But what I like to do is then switch the ice pack. Let me give you that. Cools it down, turn all the way to the right. Perfect. And then we keep going. And we go back onto this side. And we just move our way down. And we'll do this on the face and neck, because we really want to help not only sun damage, but his scarring, pigmentation, pore size, etc. And I think it's important for people to understand that to take care of your skin, it's a treatment plan. It's just like going to the gym. You can't expect to lose weight or be a bodybuilder if you go once every 3 months or 4 months. You've got to make it consistent. So for him, he's got a regimen of a facial every month and a peel, a stronger laser every few months. Now you follow that regimen consistently, and you will get beautiful skin. Okay, you're going to feel a cord over you just a little bit. We go nice and slow. The other thing about the Fraxel device, this technology has been unable to be copied even though numerous laser companies have tried. The device has a rolling laser, and you can see as we roll, the little channels get implemented into the skin that you can't see. This is called intra-optical scanning, and it makes it so it's very even. Every pulse, every roll makes even delivery of energy, so that when the person peels, it's completely predictable. And that's very safe. This is why I like the intraoptical scanning type treatments. We just follow the pattern. He's doing great. He's almost there. And we got to go all the way up and around the eye to help fine lines and wrinkles, crow's feet, etc. Doing 8. Anywhere between 6 and 8 is really good. We're doing a very strong treatment level. So, you know, even if you got 6, we're still going to be where we need to be with energy delivery. You've got to watch the skin and understand the skin. That's why going to somebody who's an expert for this type of treatment is really important, because anyone could tell you to plug in a number, but if I'm watching the skin and I see it reacting in the way I was trained, I might want to not do as much energy. But for each pass, we want to get a nice even application. It's like paintbrush, a little paintbrush, or painting laser energy across the skin. I'll show you guys the neck in a second. How do you feel your skin looks right after this treatment? Yeah, after a week after this treatment?
Really good.
Yeah. What do you notice different about it?
Then glowing.
Glowing, yeah, I love that. It's very soft, the pores and everything, right? Like there's a lot of radiance.
Yeah.
That's why I like to do it too. I'm gonna do mine in a couple weeks. My best friend's coming from San Fran. We're gonna do it together and videotape. And he asked to do it and I said, no, you're not certified. So he ain't doing it, but to me. Last pass. Skin looks great here. The other amazing thing about this is you can do eye area.
What's the best laser treatment for skin laxity?
Skin laxity is the Fractura, actually, but combined with thermogenol therapy yearly. And we're going to go on to the neck. Hold on 1 second. Just going to lower the neck. You really don't need that much energy. I'm going to take this for a second. Hold this on this side and then turn to the left. Yeah, turn to the left. And lift your chin up for me. So we're going to go his neck a little less. You don't need... Now, laxity in your 30s is more crepiness and just soft skin. That's where we're doing microneedling radio frequency like Fractura, combined with threads, is very good for young people. Thermogenol therapy, which are stronger ultrasound and radio frequency tightening procedures, those should be done once a year when you're younger. And Sculptra can be used at least once a year or twice a year. Now, how does the neck feel compared to the face? Same, different, or more? Usually people say less, but I never know. That's why I asked.
But already.
Yeah, you're very good. He's doing really, really good. So we go nice and even, all the way up, down the neck into the chin, covering the whole area. Remember, this is optical scanning, so we're getting really even delivery of the energy. And the neck does not require, it's thinner skin like the eyelid. It does not require as much energy. You don't need significant downtimes here to get a nice improvement, okay, you guys? So that's the key. You don't have to be super strong all the time. Now maybe when we do peel on him next time, we'll go a little stronger with the peel superficially. But remember, this energy gets delivered deeper to build collagen over time, so it's not a necessity to go super strong here in a preventative maintenance treatment. But this is still the gold standard. All the other companies have tried. No one succeeded in copying. We're gonna do one more pass here. All right, last pass. But again, just important just to go nice and even over the skin, covering every area. And I go the full neck. You can go all the way around the neck if you needed to. We have, you know, people that are exposed to the sun more often. You can do everything. Any skin that needs to be treated. Okay, I'm gonna switch sides and put that on your neck, on that side. So aftercare, I'm very particular. Turn to me just a little bit. Perfect. Very particular on aftercare. I truly believe that your cells are dehydrated. They're now open, the pores, the channels for delivery of serum products to be able to get much more improvement. So everybody does an exfoliating, enzymatic exfoliating cleanser. I feel this cord a little bit. Everybody does vitamin C, vitamin B, kojic acid, hydroquinone, and retinol, and a growth factor, whether it's a stem cell therapy or a peptide. Everybody gets that, and I require it. I tell them, look, don't do laser for me if you don't want to do and follow this plan, because that's what's going to give us the best results. That's going to make you heal much more quickly. Our patient here actually loves this liquid gold oil that we use that decreases oil production, and it also is anti-inflammatory because it has gold flakes in it. You can also use a company called Rev Skin makes a product called Silver Moist, which is antibacterial, so you don't get any acne after this procedure. And also it's anti-inflammatory, so you're less inflammation post because of the colloidal silver that's in it. Topical silver is very good for your skin when done properly. Topical silver needs to be done in short quantities, in the correct application. Almost done. I'm going right over any of the scars he has previously. Now lay your head straight for me a sec. Chin all the way up. There you go. Just going to make sure everything's even in the center. One more pass. Last pass. Perfect. And then what I want to do, great, is now we're going to give him this cold air. Hold this for me. Okay. Blow that on your skin, and he's going to cool down. And then we're going to go in the last phase. We're going to use an erbium laser to treat some scars, and then we're going to do PRP microneedling to finish.